Let's all read this paper together. The title of this paper is Remote Ischemic Conditioning Helps Protect Our Heart, Brain, Kidneys, Lungs, and even Liver by Reducing Damage and Enhancing Protection. Hello everyone. Today I want to share with you a very innovative medical study called Remote Ischemic Conditioning, abbreviated as RIC. It sounds very technical, right? But the principle is actually quite simple, and it may help protect our heart, brain, kidneys, lungs, and even liver by reducing injury and boosting their defenses. Why do we need remote ischemic conditioning, RIC? Sometimes our body faces dangerous situations where blood flow is interrupted, such as heart attacks, myocardial infarction, strokes, heart surgery, or organ transplants, ischemia in kidneys or liver. Doctors try to restore blood flow as quickly as possible, but the problem is that when blood suddenly returns, it can cause a surge of free radicals and inflammation, leading to reperfusion injury. This is why many patients still suffer complications even after successful rescue. Scientists wondered if there is a way to train the body in advance to better resist ischemia and reperfusion injury. The answer is RIC. What is RIC? It involves placing a blood pressure cuff on the arm or leg and repeatedly inflating it to stop blood flow, then deflating it to restore blood flow. Each cycle lasts about 5 minutes and is repeated several times. This brief, controlled ischemia followed by reperfusion stimulates the body to activate a self-protection system. In simple terms, it uses short periods of restricted blood flow in the limbs to signal the body. Activate protective mechanisms to safeguard the heart, brain, and other organs. 3 types of RIC. 1. Preconditioning. This is done before ischemia occurs. For example, before a patient undergoes heart surgery, RIC is applied to warm up the body. 2. Preconditioning. This takes place during the ischemic event. For instance, if a patient is having a stroke or heart attack, RIC is started immediately. 3. Postconditioning. This is performed after blood flow is restored, helping to reduce the side effects of reperfusion. The protective time window of RIC. Research shows that the protective effects of RIC are not permanent but have a time window. First phase. The effect appears quickly but lasts only 2 to 3 hours. Second phase. It reappears around 12 to 24 hours later and can last for 2 to 3 days. This means RIC provides not only short-term protection but also a delayed second wave of defense. The protective mechanisms of RIC. Scientists have proposed several key mechanisms. Neural pathways. Nerves in the limbs transmit the ischemia signal to the brain and heart. Both the sympathetic and parasympathetic nervous systems are involved, especially the vagus nerve, which helps protect the heart and brain. Humoral factors. Bloodborne transmission RIC triggers the release of protective substances into the bloodstream, which reach organs like the heart, brain, and kidneys. Possible substances include nitric oxide, NO, adenosine, microRNAs, brain-derived factors, and anti-inflammatory proteins. Immune and inflammation regulation. RIC reduces harmful inflammatory cytokines, such as TNF-alpha and IL-6, and increases beneficial anti-inflammatory cytokines, like IL-10. It also modulates immune cells to minimize tissue damage. Antioxidant effects. RIC decreases the production of free radicals and increases antioxidants, protecting cells from damage. Clinical applications. Currently, remote ischemic conditioning, RIC, has been tested in various clinical settings. Cardiac surgery reduces heart damage and lowers mortality rates. Stroke improves neurological recovery. Kidney transplantation decreases kidney injury. Lung and liver surgeries reduces inflammation and tissue damage. Organ transplantation helps transplanted organs adapt more quickly. Although some large clinical trials have shown inconsistent results, overall, RIC appears to be a highly promising adjunctive therapy. Future challenges. Scientists point out several issues that still need to be addressed. Which patients are the best candidates for RIC? How long and how many sessions are needed for it to be effective? Since blood pressure varies among individuals, how should the pressure be set? How can reliable biomarkers be identified to determine whether RIC is truly effective? In summary, remote ischemic conditioning, RIC, is a simple, inexpensive, and non-invasive method. It may help protect multiple organs, including the heart, brain, kidneys, lungs, and liver, by reducing damage caused by ischemia and reperfusion. Although further research is needed to confirm its benefits, RIC has the potential to become an important supportive tool in future medicine. It's like giving the body a practice run to better prepare it to resist real threats when they occur. Do people truly believe that healthy medicine and RIC can promote wellness? Hurry and purchase a healthy RIC sphygmomanometer to enhance your health every day. Don't forget to scan the QR code. Thank you all for watching. I am Dr. Andrew Shu Lee. Until next time.